Welcome to the online drought series. This is the second of the sessions that have happened. My name's Libby Swain, and I'm an extension team lead with Dairy Australia, based in Western Victoria, in a very cold, wet Western Victoria, as you just heard from Debbie. So thank you all for joining. I'd like to start by acknowledging the traditional custodians of the land throughout Australia and their connections to land, sea and community. Today, I'm joining from the lands of Goolagin people of the Eastern Maar Nation, and we pay our respects to elders past and present and extend those to all Aboriginal and Torres Strait Islanders that join us online today. So this is a fortnightly online series that is designed to provide information support for dairy farmers that are navigating drought and dry conditions. We're holding these sessions every second Wednesday from 12:30 to 1:30, and we're bringing together internal and external speakers to share updates, tools and insights on some of the current challenges that are happening on farm. So it'll be a 30-minute presentation, and then there'll be a 15-minute question and answer session, which is optional for those who wish to stay online. So if you've only got 30 minutes, please, you're welcome to leave, but more than welcome to stay. There will be the opportunity to submit questions throughout the session, and if you just look at the bottom of your screen, you'll see a little chat button, and you can just enter your questions throughout the session in that, or if you'd just like to hold them to the end, if you want to get off mute and talk and give us those questions. So each fortnight we're covering a different theme, and we're going sort of from feed management, water management to financial support and wellbeing services, and it's to help you make those informed decisions and access the right support that's available. Now, I'd just like to note that this meeting is being recorded, and we will circulate this via email to all those who registered, but it'll also be available on the Dairy Australia YouTube channel, so you can go back and look later, and it will be shared beyond this group. The series is aimed to be informal, interactive and farmer focused. So we do really welcome, I just want to reiterate about that, welcoming your questions. So please use that chat button to submit your questions. In the background, we have Ash Gardner. She's the Stakeholder Engagement and Issue Manager at Dairy Australia, and she's going to facilitate the question and answer session. So she'll put a little message in the chat just so that everyone knows where you're going to find that. It'll just pop up with a little message has been entered. Now to get started on today's sessions. So I'd like to introduce to you Dr. Debbie Twiss. Debbie's a extension advisor based in Western Victoria. She's a qualified vet who continues to do a bit of locum work over weekends. But her role with Dairy Australia and part of the extension team is a focus on animal performance. And today Debbie's going to present on transition and downer cow management in the current situation and with the current conditions. So thank you, Debbie, from a cold Warrnambool.
Thanks, Libby. I will share my screen. It's been a while doing this, but hopefully we'll move smoothly across so that I hope now everybody is seeing the presentation mode. So, yep, I can see people nod. Awesome. So welcome to it, guys. What I want to do is just a little bit of setting the scene and just talking about just how long we have been in these very prolonged dry drought conditions, because it's going to take us a while to come on out of those conditions, and thinking about some of the challenges our cows are now facing even before they start their transition period. So just looking at what the rainfall has been like, I'm just going to present the autumn rainfall in Victoria. That's where I'm coming from, where we've got about 22% of the Australian dairy farmers who have all been impacted by these dry conditions. And just looking at the autumn break here, because the reason I chose the autumn break is that's what matters to us a lot. We do for our calving and if we're now really depending on spring, but usually we talk about the autumn break. And it's just interesting to have a look here at the map just to orientate you around. Hopefully you can see my cursor. But this part here is Portland. This little bump is Warrnambool, and in between is what would be one of our driest areas. Does that look right? Can you see my pointer, Libby? Cool. So this is Yambuck, and that opening slide that I had on there was a picture taken of Tower Hill facing towards Yambuck in April this year. So in 2023, we would have had about 100 to 200 mil of rain in that April-May period. 2024, it was looking a bit drier at that 50 to 100 mils. And then in 2025, if you look at that same area, we're now bright yellow and down to 25 to 50 mils. And that would be pretty optimistic, even at around the 25 there. So we've had a failure year on year of the autumn break to give us what we really needed in terms of having rainfall at a warm time of the year. So when we think about what are the challenges we're now facing here, there are three main challenges that we've got. We've got a decreased availability of alternative fibre sources, as shown here in the June Dairy Australia byproduct report. Almond hulls have been limited to contracts and they've been delayed in shipment. The palm kernel shipment is expected late June, early July, but it's already contracted out. Hay that is in region is probably already on contract. There are more stock being grazed at home. Young stock have had to stay home this year. There hasn't been the adjustments available. And there's reduced stocks of homegrown fodder across agricultural enterprises right across Australia. So there's now many more farms entering the marketplace looking for fodder. So there's more competition for fodder, driving prices as well. We're now seeing fodder being moved into Victoria and South Australia from Queensland and Western Australia as well. So added cost of freight there. So where does that leave our cows? Well, we've now got cows who are going to enter transition periods. So they're going past their 6 months in calf period, where that fetus is now starting to have a really big demand for glucose. The udder's got a demand for glucose, and unfortunately the poor cow comes in as a poor last third candidate in the line for glucose there. Fetus and milk production take priority. So what it amounts to is that we see here now we've got cows with reduced dry matter intake, plus we have reduced dry matter available to give those cows, giving them an acute energy shortage. So to match that energy shortage, in the short term, cows can mobilize their own body fat, and they'll do that to some extent. But there is a cost for it. Metabolically, the liver's got to pay a lot of that cost processing that fat going through the body. If there's too much being mobilized, we're going to start seeing more fatty liver syndromes. We have been seeing it, cows going down with ketosis. So there's a build-up. When fat is processed by the body, it gets broken down into ketone bodies. They're not as preferable for energy versus glucose. These ketone bodies can affect cows, and when they build up, we get these conditions of ketosis, cows going down either well before calving at the moment with what we call starvation ketosis, or close up to calving, and we'd call it pregtox. It just means the demand from energy is coming from different sources, but the impact for the cow is the same when she goes down. Some of them, with nursing, care, ketol, and more feed, they will get up. Others won't at the moment, is what we're seeing. But there is a further impact for these cows that suffer with ketosis, as well as the lowered milk production. Fertility is going to be impacted in these cows. They're not going to have good production of eggs. There's going to be less ovulations, and the conception is going to be poorer and weaker in those cows. And they're going to have a lowered immunity as well, so less resistant to disease or more risk of having mastitis. So that's the challenge that we face coming into transition period. So what can we do about it? I want to look at what are the goals of transition, just a quick reminder through what we're trying to achieve, the risk factors for getting a poor transition that may be in play this year, and the challenges of feeding transition cows and what strategies we might have available to us. So we'd like this kind of little rural idyllic picture, cow, calf, doing well straight after calving, and replacement calf for us. So to get that for our goals, what we're trying to do is maintain body condition score as much as we can. Because if we've got cows calving in less than a body condition score of 4.5 and they start really dropping that body condition score between calving and joining, then the impact on fertility is much greater. It's much harder to get those cows to have a fertile conception. Also, we're going to have increased problems with metabolic disease if we can't hold body condition score well. We tend to see more problems happening with LDAs, left displaced abomasums, where that fourth part of the stomach is supposed to lie midline starts flicking up to right or left side, usually left. We also have, we would like that body condition score just so the liver doesn't have so much work going on it. It's already an organ that's got to work very, very hard during transition to give us a successful setup for lactation. We'd also like to stimulate the cow before calving with our transition diets to try and get her to release calcium from her own bones. She's not going to have enough to eat just in her diet there. Also, that calcium is really important, not just for milk production, but for immune function, for reducing the risk of mastitis there, and improving fertility. And finally, at the base of it all is making sure that that cow's rumen is adapted from a pretty dry diet in the dry period coming through into what we want her to be able to take into her ration as a milker. So those are the three main goals summarized of what we're trying to do with any transition program, even in constricted conditions like we have this year. The risks that we're facing, or the cows are facing this year, and people, are that we have a lack of energy, a lack of fibre, and a lack of protein. And if those things are not being met, then we're going to have more chance of more of that acidosis potentially happening when we've got less fibre. We're going to have more fat mobilizing, so that liver's under pressure, and we're not going to have that immune response so well. So it's going to take cows longer to recover and for their uterus to repair and be ready to take on another pregnancy after calving. Also, if we've got more imbalances of magnesium, phosphorus, and calcium, then we may see milk fever, not necessarily because of a primary calcium deficiency, but because also magnesium's not there in the diet. When we've got higher hay and lower dry matter intake, magnesium can be down. And we're already seeing in this region farmers getting responses to putting in mag chloride into troughs. So it's something to be kept in mind, and vets are certainly well aware of that when they're out there talking to people, and so are the nutritionists. Also, we need to think about the cow comfort as well. Cows that are colder don't tend to have as good immune system. And when we do get more rain coming down, more consistency, then we're going to have cows potentially in muddy conditions. So that takes energy to be in muddy conditions, but also higher risk of mastitis infection, environmental mastitis, and also higher risk to calves that are being born in those conditions, and more difficult just for people to get out there and get feed out to those cows as well in those conditions. So what we're trying to do is we're trying to build a really strong base in a really challenging year when we don't have fibre necessarily in region, or we're waiting for it to come in for some people. So we want most of our nutrients to come from that fibre base and then build on it with our byproducts and our grains. What that means is we'd like to have physically effective fibre in the transition period about 25 to 30%. So what that means is of the forage in a ration, we'd like at least a quarter of that forage to have a length of about 2.5 centimetres. That would give us a nice raft sitting in the rumen and help that rumen function well. We'd also like for energy for those cows, the kind of diets that we're usually trying to get around is about 11 megajoules of ME. But the work Ian Lean showed was, okay, if we do depress dry matter intake, it's not good. But the biggest thing that had the impact on fertility later on was actually if we didn't meet the protein needs, metabolizable protein. So that's the note down there at the bottom. We're trying in transition period to give cows about 1,200 grams of metabolizable protein a day. And that's parallel or compare. That's what that 14 to 16% crude protein in a ration will do for cows if we're providing them that kind of transition diet ration. And then we want to think about the DCAD in a ration. If we're feeding DCAD diet, so DCAD being the difference of cations, that's the negative things like your chlorides and your sulfates, minus the anions, which are your positive things like your sodium and your potassium. So we want a diet that's more down towards the negative end. Ideally, we'd like it at minus 100. Zero's great. If you're in a really high pasture condition this year because you just don't have fibre, but you've got grass coming away, then potentially you're going to be sitting much higher, especially if there's been fertilizer gone on. So you're looking at a New Zealand kind of condition, you're sitting somewhere between 400 to 600 possibly in your milli equivalents there for the diet. But even so, dropping the DCAD down just a little bit will make a difference. You might not see it in the urine, and you don't necessarily need to see a change in urine pH, but just a change in that dietary DCAD downwards will help the cow's body to understand that, hey, I'm a little bit low here. I need to put some positive ions out there to balance my blood to get that pH balance where I want to be. The positive ions they do is they take some calcium from the bones and release it out. So it is worth putting the investment in time, having a discussion with your nutritionist, how you might manage that calcium risk with DCADs this year. So we've got the calcium there. We usually try and keep calcium in dairy cows low, around 0.4 to 0.6%. I know some cow diets out there, they try to keep it high. I'll show you with a nice graph a little bit later why some do work, but it is a difficult way to manage calcium milk fever risk. So just to go back to this forage piece, because we've got lots of different kinds of forages coming in. If we haven't got hay this year, there have been some other straws and things coming on the market. And the thing to think about straws is we want to think about what's the neutral detergent fibre, the NDF people talk about. What is this NDF? The NDF actually tells us how bulky that feed is. It's kind of like saying, how many Wheat Bix can you eat? How much bulk can you possibly take in? So when you take a forage sample, or the lab gets a forage sample, they're going to take that sample and they'll put some neutral detergent with that sample and see what comes out. What's left is what they call the neutral detergent fibre component, because all the goody bits, the cell contents, have been disintegrated by the detergent. Then they'll take that NDF part and they'll soak it with some acid detergent. This is getting pretty serious now, when all you've got left is the ADF. That ADF is it's kind of like tree trunk material. That's not very digestible. And we do want to know what the ADF is sitting there, because there's some fibers you'll see out there that look pretty good on paper when you look at the NDF, but they've then got a high ADF, things like grape mark, things like palm kernel. They don't have a great useful effective fiber in there, but they do have a lot of this ADF as well. And one of the ones coming on the market would be something like rice straw. It's got a lot of silica in there. So there's not a lot of nutrient in there, and it does and you'll see a higher ADF in that product. So those are some terms you'll hear on the market. Just as some rules of thumb, for the NDF percent of the diet, we'd like it to be about 1% of the body weight. So 5 kilos dry matter of a diet could be NDF for a 500 kilo cow. So just that mention again, what we're looking for, as well as having NDF low, indicating that it's digestible, we want to have a good fibre length, so the effective NDF as well. That's really important when thinking about making these diets up. So we'll share with you, if you haven't already seen, the Dry Seasons Resource Booklet. This is an article there on the different fibre sources. If you're considering these little rolls of hay are to represent what hay is like, what you may be used to having in a diet. The little symbols this side are almond hulls where they fit. And you can see the issue where we have about palm kernel. It's got quite high energy in there, which is great. But as for being actually physically effective for a cow's rumen, not so much. So whilst you might get some energy from it, still have to think about what are you going to put in there to have a functional rumen for these cows too. So that table's in that resource booklet to have a look through if you're considering some of the other interesting things that might come on the market. Another thing as well as getting a nice balanced ration that meets, hey, yeah, I've got it, we've worked together and we've got something that we can feed the cows, is to really have a think and consideration this year about, are the cows actually getting all of the feed that we're planning, especially at the prices feed's coming in. This photo here is, I worked with a farm, we were looking at the transition ration, and this was our plan. In my head, I said, okay, yep, we want about 70 centimetre lengths in the trough length for each of these cows, and then they'll have a good access and they'll get to it. So that's what we had planned. We had the troughs, we measured them out, calculated on the paper. That was great. I had forgotten to take the paper down to the paddock and show it to the cows, because this is the kind of thing that was actually going on. We noticed that some of their body condition wasn't where we thought it should be. And what happened is that some cows were just a little bit smart and they were able to turn their body side on and take far more than their fair share, meaning some of the others, especially the younger ones, weren't getting any access. It was just simple. We just had to put more lengths of trough out. But it's always good to test your plan and have a look at what the cows are making of your plan as well. Now, I wanted to have a quick word about milk fever. Why do we really have to think about it and still have to address its issue for cows and for herds? So for every cow in a herd that you see with clinical milk fever, this is the one who goes down, you give her a bag of 4-in-1, she gets up, great. But how many others in your herd, if you consider her the canary in the mine, because she indicates, yep, there is milk fever in this herd. For every cow that actually goes down and needs to be treated, there's probably about 8 others cows in the herd who are a little bit low. You won't see clinical signs, but her milk production might not be where it is. Her immunity won't be as good as it is, and her fertility will be down this year. So they won't show it to you by actually going down, but they'll show it to you in other ways. So we have this in the transition cow management resources as well. And this is just having a look. There are some targets here. So I'll show you the resources later that have these targets in for, particularly for milk fever. If we're seeing more than 3 cases going down in every 100 cows calved, there's probably some opportunity that we can do to try and reduce the milk fever happening in the herd. And we'd start with having a look at the transition diet. Is it balanced well? Also, though, the other things that we want to control here around fertility are looking at the retained placenta, your assisted calvings. These things are going to have an impact on fertility later on if cows show up with these at calving. And then lameness, because if you're not walking well, then you're certainly not going to be getting onto the feed that we've got out there for you. And we'll see a reduced impact, both in milk production and fertility in lame cows. So if we don't manage to control our milk fever and we open up the gateway, this is what the gateway to milk fever for these cows, both for the clinical and for these subclinical cows, they're going to have a decrease in feed intake. And that's the number one thing that's going to stop us getting the milk production that we could get out of our herd. That will lead to, obviously, the decrease in milk production, but also a decrease in body condition. And that lowered body condition, if cows are still losing weight as we're going towards joining more than 80 days post-calving, that's going to have an impact on fertility. It's going to drop conception rates. It's also going to drop the rate with which cows actually come up cycling as well. They're going to take about 16 days longer if we start having that happen. It's also a time that if we don't control milk fever, it does contribute to seeing more reproductive failure and more involuntary culls during that period. So about 80% of animal health costs will happen around the transition period, that 4 weeks before and the 4 weeks after calving. That's the critical time for managing cow health to reduce costs for animal disease on farm. Now, why did we say earlier on? Because some people will say, hey, I could manage my calcium up here. You can. It's a very gritty diet to try and manage calcium above 2.2% of the total diet. And that's why most of the time we work at keeping the diet pretty low, around about 0.4 to 0.6% of the diet is we will keep for the transition diet for these cows. So that's where the DCADs try and help get cows to release more calcium from their own bones rather than having calcium sitting in the diet pre-calving, which then cows aren't going to release their own calcium. They're going to think, I've got enough. I'm going to be in storage mode rather than release mode. And the key for getting our cows to have enough calcium to meet demands at calving is to make sure that they're releasing their own bone calcium. So what can we do? What strategies are out there? We can look at what are we going to plan, monitor, and measure. And one of those things is we can have a look at the body condition score. If we know that the herd's coming in light, then having some options there. What are we going to do around fertility? Can we put on more body weight on those cows pre-calving as well? If we know that we're approaching calving and they're not going to be reaching between the 4.5 to 5.5 body condition score out of 8 on the Allen Banks score. For heifers, we're looking at a weight or body condition score target for having them calving at around 22 months. So we'd also want to just keep in mind what's happening with those. Some people are having a look at putting some extra energy in the heifer ration now. We'd still want to keep up with mastitis prevention. That will be critical as well this year, particularly fingers crossed that the rain does come down and they will be in muddy conditions. So environmental mastitis could be a problem. And thinking about those cows as they go into the transition group, observing them. Are they cows that need to gain weight, or are they cows that can just maintain? And this might be a year where, although it's a pain to have several mobs, it might pay out when feed is really, really tight, because we don't need to give some cows who have got good condition more than they need there. I know there are some like that little Jersey I showed you who'd like more than their fair share, but it's our job to try and make sure it's spread around. And then thinking about the diet to reduce the risk of calcium. So thinking about those diets, we want a calcium level there about 0.4 to 0.6 we showed on the graph Y. We'd go low, not high. We want magnesium in the feed to be about at least 0.45%, if not a bit more. The phosphorus needs to stay down low. And they're tied up, the magnesium, calcium, phosphorus, and how it's transported around the body. And we want a negative DCAD, or at least if we could just drop it down a little bit negative. And we want exposure to that of 21 to 25 days. There's no advantage beyond sort of 28 days. And there is, if you only go 14 days with a low DCAD, if that's the strategy you're using, then we don't get the benefits as well there. And then thinking about where's water coming from, shelter, and having a clean calving area as well. So that's the 4 weeks before calving. When we think about the 4 weeks after, there has been research done at dairy feed base looking at different mixtures to be feeding cows after calving and showing different responses. So in a quick summary of that kind of work, what we see is that feeding maize in the fresh period, so the first 21 days post-calving, we will get a response, but we need to have it with a really good forage. And the trial, that was a summer trial, so they did chicory as their forage. It had that lower NDF that we were talking about. If in the trial they did it also with a rye pasture hay, it didn't really show any response of the maize. So it's important to talk to your nutritionist. If you're thinking about trying some of these strategies to push milk production post-calving, think about what else is in the diet, and will you get the response? Is it likely to get the response? Then in the early calving period from days 22 to 100, they did see a good impact of putting canola meal into the mix. So they did a wheat barley canola. Canola's got that protein. Remember, we were talking about the importance of protein for cows. So not just in the transition, but also going forward, canola had a role there to play as well. And so when we think about it, in the transition period, those 4 weeks before and 4 weeks after, we've got the liver. That's the big organ that controls metabolism, and the way it's functioning determines how well the cow functions. After that first 4-week period, when we go into the early lactation period, then it's actually the physicalness of the feed that we're feeding to cows that'll actually determine. So that NDF starts to have a really big play in our early lactation cows as for how much extra they can eat. And fingers crossed, rain comes and pasture grows, and they need to get out there and eat that pasture. So it's important to check how the rest of the diet balances there, and think about the qualities of fibre that we're going to feed early lactating cows too. So there are benefits to managing our transition risks, and this was some work they looked at. What were the benefits if you compared cows who did get well-managed transition and managed the milk fever risk versus those that didn't? There was a 40% reduction in milk fever, a 40% reduction in retained placenta, a 60% reduction in total disease around the transition period, pre-calving, and also an increase of dry matter after calving of 0.65 kilos per cow per day. So transition is an investment, and it does pay back. But sometimes we still, no matter what we do, there are some cows who may go down, and that's why I wanted to have a quick look at down cow management, because it does take time, and this year may be a year that time is very pressed when we're feeding out. So just wanted to have a look at some of the considerations. But why do cows even go down? Well, just over 60% of cows are going to go down because of injury to the back or calving paralysis, so things happening around calving there. And this was work that was done in the winter of 2012 and 2011 with Phil Polton over in Gippsland. So there was enough data here to see, yep, these were significant for reasons that cows went down as well. Just to define, because you may hear the term down and you may hear the term downer. A down cow is any cow who is unable to stand. It's not time dependent and it's not dependent on what her mental status is. That's just a down cow. So some of those cows that go down with pregtox, they're a down cow. Some of those cows who go down with starvation ketosis, that's a down cow. A downer, on the other hand, is where we've got a bright, alert cow and she's been down for more than a day. And this might be the kind of cow that you have to deal with once you've dealt with the initial problems in the acute phase. So in those first couple of hours, what's really important, once you've got the cow in an area that is as safe a situation as possible, so IAS was just as soon as safe situations safe. So sometimes cows can be trapped under fences, those kind of things. They need to be got safe. You need to be safe. But once you can start having a look at those cows, then it's those cows who have gone down. It's important to diagnose what was the actual problem and address the problem quickly. I also put in there, and if you haven't got this hotline in your phone, could I ask you to pop this number in your phone? It is 1-800-675-888. Other states might have a slightly different number, but it's the emergency animal disease. And it is important to think, because we kind of get in a mindset, we're busy and it's calving. She's gone down because she's gone down with milk fever. But if you suddenly have a whole bunch of cows going down, 2 or 3 suddenly very quickly, just keep in the back of your mind that it might be something different and it's worth a phone call and a chat to someone. Also, there's money to investigate those cows as well. So the labs may be paid for already, but it's important that we're aware of other problems that happen in districts at this time of year as well. So once we've addressed the issue, whether it's a bag of 4-in-1 for a standard milk fever, then can we try and stand this cow and lift her with support if it's appropriate at that time to get her moving. The thing we don't want them is staying down longer than they have to be staying down just because of the damage that happens to muscles. So this is the consideration about nursing care beyond the acute phase. So if a cow's down more than 4 hours, that's half a ton of weight down on those leg muscles. So if that cow starts to go, she's down and she starts crawling around, she may damage her muscles and she may also damage her spine where it comes out the lumbar spine. So there's 8 times more likely if you don't do that to recover. 87% of cows in the study, and these were farmers that were able to nurse them however they chose, and Phil was just watching them in the study, but 87% of cows who didn't get up had damaged either their muscles or their spinal nerves. So if cows aren't nursed well, there's less than a 10% chance that they'll get up. So we need to have that discussion even prior to calving, is what's the capacity of the farm and everyone around to be able to nurse those cows well. So in here, this cow, you might see in the background there, those hay bales actually were around this cow. It's taken away so we have a nice photo of her. But she couldn't crawl around because she had hay bales put round her. It was late spring, early summer, so the ground was still pretty soft where she was under this tree, so it was deemed that was okay to have her there. She had feed and she had water brought to her as well. She was rolled every 3 hours as well. Her owner is a sports person who really understood the impact of protecting muscle function. And hey, it can be rewarding. Same cow, next morning standing up a lot happier. So it is worth it if you can spend the time, but it's also worth being mindful of what the capacity is if you can't have that time for cows, that less than 10% will recover without nursing if they stay down. So it may be a case of doing an acute phase, seeing how they respond, and then having a plan. What are you going to do if they don't respond after 4 to 6 hours or after 12 hours? So what tools have we got there at hand? I just wanted to point out some of the checklists that are available for you and some of the little calculator tools that are available too. So we've got the checklist for transition cow management available for people to use, just to go off and go, yep, I've got those things covered. We've got the milk fever risk calculator still there, so you can put in your diet, your little library, and have a play around. What would happen if I add a kilo, take out a half a kilo? It's there to be used to look at both the risk of milk fever, but also the risk of providing a diet that isn't high enough in energy. And then there's a transition program program review worksheet. This is a helpful worksheet because it's got the targets of all those diseases that I put in. When is it okay? And when is it higher than expected? So useful sheet there. There's also a tally sheet, which people, if you thought, what's the thing I might monitor to see if I've got my milk fever controlled or the low calcium controlled. So as well as milk fever, but you might see some of these other diseases and just check, are they staying in check where they should be, or are they potentially going to cause a problem? And then we've got the transition cow management. There is an online course that can be organised. See your local regional development program for that if that's of interest. And then nutritional fundamentals is a face-to-face program that we offer as well, again through the regional development programs. And finally, to summarise, plan and act within your capacity, monitor what you can manage, and reassess the outcome of your actions at 1, 3, and 6 monthly intervals. And I'd like to say I was the knowledgeable person who came up with this, but actually this was a conversation I had with a dairy farmer down a farm driveway, and he was talking about how the plans he was making to manage feed in these tight times. And this is what he came up with. He said, this is all I do, Debbie. I make my plan, I act on it, but I monitor it along the way. And if it isn't going where I need it to, I'll have a talk to people I trust, and it might be my nutritionist, and it might be the hay guy, and it might be the farmer that I've worked with a long time down the road, but I'll have a chat with someone and make another plan. I just keep moving ahead. I thought that was pretty good advice for somebody who this certainly wasn't their first rodeo at all. So when it looks using those tools that we put up, the checklist for planning, the tally sheet for monitoring, and the transition cow review sheet for reviewing afterwards. And that brings me to the end of today's presentation. Thanks, Libby.
Thanks, Debbie. Thanks for that. Just while everyone's coming back into the room and we perhaps get some cameras on for some questions, I've just got a quick question for you, Debbie. You talked about the fact that if we don't have enough fibre and we've got a bit of pasture, that there may be ways we can drop that DCAD a little bit. What's some of the options potentially there that we could be talking to our nutritionists about?
Yeah, so there is the traditional DCAD salts that have been added to diets, but if that doesn't work this year, then there is the calcium binders out there. So what was Excellent in the research, so it's a calcium binder. So it makes the cow see a low calcium diet in a different way. It's worth having a discussion with nutritionists as to whether that would be appropriate, because it does have a side effect. It can drop dry matter a little bit. So it's not something you just go, oh, buy a bag of that and whop it in. Have a good chat about that as well. And then there is the traditional methods of just adding a bit more mag chloride in the troughs, trying to get more mobilization there of calcium.
Thanks, Debbie. Ashley, have we got any in the chat? And then invite people to come off mute as well to ask questions.
Yeah, thanks, Libby. Thanks for that, Debbie. No, we haven't had any come through the chat or the Q&A function that we have activated. So yeah, if you want to ask,
Yes, any questions in the room? Vicky, do you have any questions, if that's all right?
I'm Naomi, but I work for Ian Lang, and I've actually been working for Ian for 17 years. That mainly based in South Australia, and I was one of the first people to trial that milk fever kind of incidence calculator. And I just wanted to mention that back in about 2008, we had a group get together with Peter de Gareth and Ian before they even published all of that data through Peter's PhD. And I thought, I'll bring a case study. And I think it was really interesting that the very first case study that I used with all of that, model, I had a Jersey farm here in South Australia that had 15% incidence of milk fever. It was absolutely horrendous. And they were dropping like flies. And the big thing they were doing differently was that they were feeding pasture. And like you mentioned, Debbie, earlier, sometimes dairy cow pasture has recently been fertilized with potassium. And so I quickly did a DCAD and I evaluated the ration. And I can't even tell you what the DCAD was because I was focused on trying to formulate the calcium, phosphorus, and magnesium as per Ian and Peter's guidelines. And I'd never used it before. And I was kind of skeptical, but I just really wanted to help this farmer solve a huge problem. And the weirdest thing happened was
we managed to remove most of the plastic from the diet. I think we maybe left about 2 kilograms dry matter, but we managed to get more cereal hay in, and I put in a lead feed concentrate, if you like, with Bioclor that we just started using. So I was doing it more to focus on the minerals at that point because I was trying to learn how to use the model. And then I actually went back and looked at my reports that I still happen to have. And the weirdest thing that we realized was with that updating of that ration, doing all the things that you've just described, yes, we had a profound effect. We literally got the dry matter, the milk fever incidence down to about 2 or 3%, which is about as good as you can get with jerseys. So it was a really profound effect. But when I went back and looked at the numbers and I was trying to explain to everybody in this meeting at Werribee what I'd done, the weirdest thing came to light that I'd absolutely formulated to all those calcium, phosphorus, magnesium guidelines. Clearly, I had dropped potassium because we minimized the grass intake. But the weirdest thing of all was I hadn't changed DCAD. And it was just phenomenal. So what it showed in that model is that absolutely days exposure is crucial. So you're absolutely spot on. I try and stick to 21 to 25 days, and I'm trying never to go beyond 28 because then you're just drawing too much calcium off the cow's bones. So I stick to that guideline. But over the years, of which now we're probably talking 17, I tend to focus on formulating to the calcium, phosphorus, and magnesium. And I don't get too hung up on the DCAD per se. But the reason why I think I've probably developed that way of doing things is because a lot of the cereal hays are very low in minerals. So I'm actually having to add minerals, to the lead feed diets. And so, so I do that consistently with all my clients. And I can honestly say that 9 times out of 10, we don't have a problem. But on the one occasion out of 10 where we have a massive problem, it's usually for the things that you've outlined. We've either had some more pasture or more silage sneak in the diet, or something else has changed. And so it means then you've actually got quite good control. And then getting back to what you said about the NDF and the ME level, I always struggle with the cereal hay based transition diet to actually achieve 11 ME. Most of the time it's 10 or 10.5. But in situations that I've got, if I have got skinny cows, absolutely I do what you said. I actually feed the skinny cows, the far off skinny cows, the dairy ration. They get a couple of kilos of the dairy mix that they would normally get in the dairy, to try and keep weight on. And then the other thing finally that came out of the research with Ian and Peter was that the protein of that Springer diet does actually go about high. So if you can get more protein into the diet, say bipanola or lupins, pre-calving, guess what? You'll have a higher intake post-calving, and as well as all those other factors, that you mentioned. So, so again, at the moment in South Australia, our situation is very similar to yours. It's making sure people have got access to good quality, cereal hay so that we can achieve all of those goals. But all I wanted to say was I can do a by phone service. All we have to do is test the hay for minerals. I get a really quick return out of Feed Central. And if anybody that wants a quick answer into, is this hay, what's it going to do for me in terms of milk fever? And I can do a very quick turnaround service to help people, even by telephone. So if you want to address some of those things.
Yeah. Thank you, Vicky. That really does drive home a point too that we didn't emphasize is where possible, always get a feed test to know what you're dealing with. It's so hard, otherwise you're playing a bit of a guessing game. And there's all sorts of stuff coming across. So it may need multiple samples across. I've had farmers talking about even in a load, they're noticing halfway through a load, weights are changing on those feeds coming through. So yeah, thank you for reminding. Really good point about getting feed tested and checking for mold. That's the other part that we're seeing a little bit. I don't know if you guys seen, but some of feed is coming through.
Out of bloods a couple of years ago, we had a lot of moldy hay that, wasn't tragic, but it came up on the test. But we feed, a toxin binder in that situation. And similarly with silage as well. We're sort of more comfortable doing that now. And cost wise, it's usually only about 5 cents per cow per day. So it's well worth it.
Yeah, and I think Rodrigo was just saying, just get a mold count. You don't even need to be very is not highly technical. Just know what's coming in the feed that you're putting in front of cows this transition period. Cool.
Definitely.
Thank you.
Thanks for your contributions. Is any other questions from the room? Comments? If not, we might pull it up there and give you back a couple of minutes in your day. But just as we finish today, a survey is going to launch on your internet browser, and we'd really appreciate your feedback on 4 short questions. And some of this, it helps us with topics for the future as well. So please let us know if you've got ideas on other things you'd like to hear discussed. We'd really love to know. The next session that we have planned happens in a couple of weeks on Wednesday, the 9th of July. They're always at this 12:30 for Eastern States. Obviously, Vicky, you would be a little bit earlier, but in your time. So that session will be presented by the consultant Matt Harms from Gippsland, and he's going to cover winter feed and critical pasture management issues in the current situation. Obviously, Gippsland as well are starting to see the dry conditions spread over that way as well. So they've got good experience over there. I just want to do a final reminder that this session has been recorded, and so this recording we will be sharing with everybody who registered for the event for this webinar. Not everyone could hop on today, and it will also be up on the Dairy Australia YouTube channel. So thank you everyone for attending, and we look forward to seeing you at the next session. And I hope you're getting a bit of the rain that's been hammering the window beside me here. So hopefully you've all had a bit of that. Thanks everyone.
Thanks, Liv.
Thanks, guys.